Hi folks, Canadian Prepper here. So today on the channel, we have the authors of the Survival Medicine Handbook, Dr. Joe and Amy Alton. Amy is a nurse practitioner. Dr. Joe is an MD, aka Dr. Bones. They have their own YouTube channel that you can go and subscribe to. They're going to be coming on the channel on a more frequent basis to answer your questions about survival medicine and emergency preparedness stuff. So if you have any questions that you want to direct and they're about prepping and survival in general, please feel free to put them in the comment section below, and maybe on their next appearance they'll answer those questions for you. You can show your support by picking up a Survival Medicine Handbook. This is different than most first aid books because it's all about what you can do if help is not coming. And check out my most recent video where I talk about how you can get a surplus emergency medicine supply, a prescription medication through Jase Medical. Go and check it out. I'll post a link in the description below. Now, over to Dr. Bones.
What are some of the do's and don'ts of prepping from your point of view? CP, one major do is to accumulate medical supplies as you're stockpiling food, water, and planning shelter. But accumulating medical supplies does little for someone who doesn't know how to use them. It also does little for those who just buy a kit and just throw it on the top shelf of the closet without fooling around with it. You gotta have a good medical kit, but it means nothing if you can't access it quickly nor know what you need for the problem at hand and where exactly it is in your kit. One thing that preparedness folks should do is figure out a budget so that they don't experience financial hardship as a result of getting prepared. That would be very discouraging. Another thing is to continually improve your preparedness levels over time. Some people will do a lot of panic impulse buying in the face of a looming catastrophe. Many times they'll be buying things at inflated prices or simply not be able to find the things they need because of high demand. They should begin by getting a supply of food and drinkable water that'll last them more than the 3 days or so that many government authorities recommend. Having been through a few hurricanes, I can tell you the power can be out for weeks in some cases. Even if you're bugging out, you need more than 3 days worth. Question for the Altons: what can I use for sutures and how do I sterilize it? Would fishing line work? Thread? Hi Peter. The most effective improvisation for sutures would indeed be fine monofilament fishing line, which is very similar to nylon sutures. While not sterile, they could be placed in alcohol, betadine, or chlorhexidine for a short time before use, and then threaded through a large sewing needle. A curved needle, honestly, would be best. Monofilament line doesn't dissolve by itself, so expect to remove it with an iris scissors or suture scissors between 5 days and 2 weeks after placement, depending on the area sutured. Stitches in areas over joints should remain in place at least 2 weeks. Although superglue and steri-strips are also options for wound closure, they're not effective over joints. This one's from Paula Annesley. A question I would have is, for a person on a budget, what would be the most important things to have in your first aid kit? Paula, there are a lot of different medical supplies that are useful in times of trouble and worth stockpiling. I would look for inexpensive items that are versatile enough to do double duty. For example, a triangular bandage is well known as a sling, but it can also wrap anything from sprained ankles to head injuries. Another useful piece of equipment is a SWAT tourniquet. Used correctly, the SWAT tourniquet is an inexpensive way to stop bleeding and should be at least a secondary tourniquet in any serious kit. But the SWAT can also be used with a little less pressure as a compression dressing. It can be repurposed for use as a sling. It can be used to stabilize splints in place. Speaking of splints, how about an old pillow and duct tape to give protection and support to an injured joint? There are other household items you can retool into medical supplies, like bandages from old sheets and t-shirts, stretchers from wooden broomsticks and old jackets or blankets, or cover a gauze with petroleum jelly for burns. Hold bandages in place with a section of pantyhose maybe. There are lots and lots of improvisations. Sometimes though, however, you have to be aware that some improvisations may be less than perfect. A portable toilet, for example, using a 5-gallon bucket, plastic garbage bag, and a product called the Luggable Loo, and discussed in the Survival Medicine Handbook, well, you know, if you're extremely tall or very heavy, well, it might be less than comfortable. Okay, this one's from the Faith Heart and Homestead. My number one question when it comes to grid down medical situations is with regards to infection. Can you make or refine your own antibiotics? How long past the date is an EpiPen good for? Faith, a decade ago, I published a formula for making penicillin. You can still find it at doomandbloom.net. It involves essentially an advanced chemistry lab, a little patience, and survival, a whole lot of luck. Greenish blue penicillium mold may grow on an old piece of fruit or bread, but a lot of refining goes into making it a product that's usable to treat infection. By the way, bread today has additives that discourage this kind of mold growth. The significance of the mold was actually discovered by accident. A not-so-tidy chemist left his petri dishes of bacteria out while on vacation, and when he came back, he noticed a mold took hold, and wherever it did, the bacteria he was culturing in the dishes disappeared. It took more than a decade to get from that to something commercially usable, though. Today, penicillin is still used, but many bacteria are resistant to it. While making your own antibiotic is very difficult, there are natural substances with proven antibacterial effects. Honey is one of them. Having a supply is a good idea as it's versatile and lasts a very long time. Garlic extract is another known antibacterial that's been used by herbalists for centuries. Myrrh extract is also. Some essential oils like oregano and thyme are also touted as having strong antibacterial effects. Don't forget that I wrote the first physician article on the use of fish antibiotics in survival settings. Although there have been efforts to suppress them, some are still available online today without a prescription. You can learn how to use them in the Survival Medicine Handbook, or more specifically in Alton's Antibiotics and Infectious Disease, the Layman's Guide. As for EpiPens, a study on EpiPens that were expired up to 3 years found that they were still about 80% effective. This means that, like many liquid meds, they aren't at full potency, but still have some usefulness. You might need a second dose, however, to get the same effect. Even today, the company that makes EpiPens recommends using expired EpiPens if you don't have a fresh one available. What are some of the biggest mistakes that preppers make when it comes to survival medicine and/or medical care? I would say that it's assuming that the ambulance is always heading in your direction, or that the rescue helicopter is just over the horizons. In serious disasters, the amount of injuries and illnesses sometimes overwhelms the available medical resources. If a major earthquake occurs, there may be more injuries than medical personnel to treat them. The roads may be impassable, like they were after Hurricane Katrina, where a lot of resources were available but couldn't reach the people that desperately needed them. Another thing preppers neglect that's a huge mistake is failing to take advantage of high medical technology while it still exists. Take, for example, orthopedic issues. If you have a bum knee, how long do you think you'll last if you're thrown off the grid and have to hit the road? How about vision? How many in the preparedness community are nearsighted or farsighted and rely on corrective lenses or contacts to see well? When your glasses break or your contacts dry out, how are you going to function? You might consider LASIK procedures. These take about 10 minutes to do, are very safe in experienced hands. I had it done 20 years ago, and I still have the eyes of an eagle, a very, very old eagle. But what I'm trying to say is that many physical issues that decrease your chances of survival can be fixed in modern times. You just have to get off your duff and get it done. What are the possible uses of over-the-counter Primatene spray tablets in an SHTF scenario? Can it be used for cardiogenic shock, allergy, asthma, etc.? Although not recommended as a first-line drug, Primatene Mist is an epinephrine spray that's the only FDA-approved over-the-counter asthma inhaler. Primatene Mist provides fast relief of mild symptoms of intermittent asthma. Primatene tablets, however, they're a different animal. They're a combination of ephedrine hydrochloride as a mild airway opener and guaifenesin, an expectorant or a mucus loosener. In some places, these non-prescription meds are kept behind the pharmacist's counter, so you might actually have to ask for them, like with over-the-counter pseudoephedrine. That's Sudafed, which is possibly used in meth production. It should be noted that today's Primatene Mist is too low a dosage to relieve a significant allergic reaction or certainly anaphylaxis. The tablets aren't strong enough either and would take too long in any case to have effect. The epinephrine in Primatene Mist, however, may be used for things like nosebleeds. Soak a gauze in 0.1 to 1 milligram per milliliter solution and place it in the affected nostril for about 30 minutes. As Primatene is known to raise blood pressure, it may have use in people with low blood pressure due to shock. Having said that, the product literature says it should not be used if you have heart, high thyroid, or circulatory conditions that could lead to shock. So who knows? What, if any, disasters are you concerned about in the next few years? CP, there are a lot of issues that loom on the horizon that could take society over the brink. Could it be a new coronavirus, an influenza virus? Could it be war when Russia invades Ukraine or China invades Taiwan, one of which will almost certainly occur in the next couple of years, if not couple of months? Could it be widespread civil unrest internally from a nation divided against itself and steadily weakening? Could it be some major natural disaster? All of these have the potential to destroy economies and tip us over the edge. As a physician, I'm particularly concerned about continued waves of different disease-causing viruses. Since 2014, we've seen major outbreaks of Ebola, Zika, chikungunya, coronavirus, and a lot more. There's no reason to believe they won't keep appearing, and some of them will cross oceans and wreak havoc, I predict it. What's the most important medical consideration when preparing for disasters? I'd say that it's that the materials used to treat injuries and illness and the knowledge needed to make the most of them have to be accumulated before a disaster occurs. People have a natural tendency to procrastinate with regards to a lot of things, and medical preparedness is no exception. You have to ask yourself whether you believe that the possibility of a major catastrophe actually exists. If so, you do yourself and your family a disservice by not learning some medical skills and getting the equipment needed to be effective in that role. You need to do more than just have medical items, however. You need to acquaint yourself with how to use them and how to improvise materials to adapt them to medical uses. Another medical consideration is that, in my opinion, there are going to be a lot of unnecessary deaths just from drinking bad water and improperly cooked food in survival settings. In the American Civil War, more soldiers died from dysentery, diarrheal disease, and dehydration than died from bullets or shrapnel. You should know several different ways to decontaminate questionable water. Boiling, bleach, iodine, even UV radiation from sunlight can make water safe to drink. Also, make sure you have good fire-making materials and cook food thoroughly and evenly. It's thought that eating partly cooked bushmeat started the Ebola epidemic in 2014.
All right, guys, I want to thank old Dr. Bones for coming on the channel. Great information as usual. It's great to have somebody as knowledgeable as him to come on here and share their information with the community. And remember, if you do have questions, post them in the comment section below. Hopefully they'll be picked up in the next installment in this series. And go check out the Survival Medicine Handbook. You won't regret it. If I had to choose one book for the Shizzy Hitting the Fizzy, this would definitely be it. Take care, guys. Stay safe. Keep prepping. Canadian Prepper out.
The best way to support this channel is to support yourself by gearing up at CanadianPreparedness.com, where you'll find high-quality survival gear at the best prices, no junk, and no gimmicks. Use discount code PREPPINGGEAR for 10% off. Don't forget, the strong survive, but the prepared thrive. Stay safe.